I'm very proud to introduce Dr. Mary Whipple. Mary is from the University of Minnesota, where she got her PhD. Is it about a year ago now, Mary? Is that right?
Yeah, summer 2019.
And Mary came to Colorado, and I am her primary mentor, which means that, which is both a big responsibility, but in her case, also a huge honor because she is just an amazing scientist to work with. And so she's a postdoctoral fellow, which is a period of typically 2 to 3 years after you get your PhD or even your MD, where you've done all your training now and you're ready to do the work that you're going to do. So when Mary finishes her postdoc, she'll be a faculty member. She is a registered nurse and received her PhD in nursing and gerontology from the University of Minnesota in 2019. Her research focuses on understanding the effects of sedentary behavior. And this is a new term. Don't think you know what this means, because I didn't understand exactly what it meant when I started with it either. But it's the effects of sedentary behavior, not physical activity, on cardiovascular health among older adults, with a particular focus on people with type 2 diabetes. Today, she's going to discuss what is known about the health effects of sedentary behavior and describe how her research can help older adults move more and sit less. Dr. Whipple, I'm very pleased to welcome you to the Medicine Cabinet of the Center for Women's Health Research, and I look forward to your talk.
Thank you. Well, let me take a moment here and share my screen. And also I'm going to stand up, just given my area of research. That's sort of my default, is I need to stand, plus it's just easier presenting. So anyway, let me just make sure you guys can see the slide view here. All right, can you see the full screen of the slides? Wonderful. Yes. Thank you. Well, thank you, Dr. Regensteiner. It is my pleasure to be here today, and thank you all of you for coming. Really appreciate the opportunity to speak with you today about something that I'm very passionate about, which is sedentary behavior. I am, as Dr. Regensteiner mentioned, a postdoctoral fellow at the University of Colorado, and have been a grateful recipient of center funding. And so I want to talk with you a little bit about sedentary behavior. It's been something that's been compared to smoking, that perhaps sitting is the new smoking. And so we'll talk a little bit about that and what we know about the health risks of sitting at this point. So I want to start by telling you a little bit about my background. Dr. Regensteiner told you a little bit, but I want to just kind of tell you how I got here, why I do the work that I do. I started getting a Bachelor of Arts in Biology and Psychology from Luther College, and that's a small liberal arts college in Decorah, Iowa. And that degree was really where I first got involved in research. I knew I wanted to be involved in healthcare. I wasn't sure exactly what capacity at that stage. But during that degree, I had the opportunity to work at the University of Minnesota on the study for women's health across the nation, the SWAN study, which is this large study looking at, among other things, cardiovascular disease in women. And so that was my first exposure to research and to women's health research in particular. So when I finished that degree, I, again, wasn't exactly sure what path I wanted, what aspect of healthcare was going to be the place that I would land. But I knew I had this passion for research. And so I took a position as a clinical research coordinator at Mayo Clinic in Rochester, Minnesota. And in that position, I worked in the fibromyalgia and chronic fatigue clinic. Fibromyalgia is a chronic muscle pain condition, but importantly, both of those conditions, about 90% of people that have those conditions are women. So again, these are areas where women are impacted more than others. And this really gave me the opportunity to learn more about women's health research and research on the ground. I was involved in a lot of studies in this capacity. And this really solidified for me that research is my career path. The piece I was missing, however, is although I really enjoyed interacting with study participants and patients as a research coordinator, I really felt that I wasn't able to interact with them exactly as I would like. I wanted to be able to have the medical, the healthcare background to be able to provide recommendations and guidance and support people in health behavior change. And so that led me to my Bachelor of Science in Nursing at the University of Minnesota. When I finished that degree, I passed my licensure exam and became a registered nurse. And most of my nursing career has been in clinical research rather than in bedside nursing per se. Right after I finished that bachelor's of science in nursing, I went right into my PhD program. I knew research was what I wanted to do. And this was really the ideal opportunity for me to really grow and learn about that. And so, as Dr. Regensteiner said, I received my PhD from the University of Minnesota. That was back in summer of 2019. And my PhD is actually in nursing with an emphasis in gerontology, which is the study of aging. And so that's really how I focused my research over the past decade or so. And then last fall, I came here to the University of Colorado and to work with Dr. Regensteiner in her lab and have the opportunity to learn some very specific skills that I'm going to share with you a little bit more about later on. In terms of how I got to my specific research interests, that really comes from my experience with my grandmother. She was an amazing woman. She raised 7 children by herself and had lived independently, was driving and living independently in her home in her 80s. But she also had type 2 diabetes and she had had a previous heart attack. So and her diabetes was not well controlled. That was a challenge for her. And she fell in her home one night. And that resulted in multiple surgeries. And she actually lived in a nursing home for the last year and a half of her life. She wasn't able to walk again after that. And so that experience really changed my family. It changed her life, obviously, dramatically, and it changed our family, the lives of the members of my family, really dramatically. And so she's the reason that I do research in diabetes and cardiovascular disease, and the reason that I'm focused on older adults in my career. So diving into a little bit more of sort of the reason we're here today to talk about sedentary behavior, I want to stop for a moment and talk about a couple key definitions. So first, you've probably heard people talk about both physical activity and exercise. Although they're often used interchangeably, they are not exactly the same thing. There is a difference. So physical activity is any movement that requires our muscles to work and requires energy. Whereas exercise is planned, structured, and purposeful physical activity. So for example, my walk to the kitchen is technically physical activity, although light physical activity, but it's not exercise. And so that's kind of an important distinction. We do know that exercise, or what's often termed in the literature, moderate to vigorous physical activity, is important for health. Lack of physical activity has been linked to 9% of premature death worldwide. So it's an important predictor of death if we don't get adequate levels of physical activity. This moderate to vigorous physical activity has been proven to reduce the risk of heart disease, high blood pressure, diabetes, cancer, osteoporosis, death, lots of conditions. And so we know that physical activity is very important for health. It's an important aspect of staying healthy. And in fact, on the right side of the screen, you'll see the physical activity guidelines for Americans. This is a screenshot of the 2018 guidelines. These guidelines are released by the Office of Health and Human Services and actually summarize the evidence and then provide us all with recommendations based on that evidence of what we should be doing to try to stay healthy. The first guidelines were actually released in 2008. In fact, Dr. Regensteiner, as well as Dr. Wendy Court, were on the original guidelines committee to gather all of this evidence together. And these guidelines were updated in 2018. And so you can see here the recommendations are that we achieve at least 150 minutes of moderate intensity aerobic activity. And that's anything that makes your heart beat faster. So it's things that require more energy. Another way it's often described is you can talk but not sing. So you're working a little bit, you're breathing a little bit harder and working a little bit harder. In addition to that, we're also asked or recommended that we get 2 days a week of muscle strengthening activity. So this is weightlifting or other things that make our muscles work harder than usual. So this is physical activity and exercise. Now I'm going to turn to something a little bit different and throw a new term at you. And this is sedentary behavior. And as Dr. Regensteiner alluded to, you may not actually know what it is. It's often used. It's often used interchangeably sort of with physical activity, but they are not opposites necessarily. So sedentary behavior is waking behavior that uses a small amount of energy and occurs in a sitting or reclining posture. So this could include things that we do when we're sitting, commuting, working, screen time, lying down in the evening watching TV, something like that. Those are all sedentary behaviors. Importantly, sedentary behavior is not sleeping. That's categorized in sort of a different aspect of activity, because we know that sleep is important for a lot of things. But more importantly, sedentary behavior is not physical inactivity. So oftentimes those terms are used interchangeably. But physical inactivity actually refers to not meeting those physical activity guidelines that I was just talking with you about. So if someone does not achieve that 150 minutes of moderate activity over the course of a week, technically they could be defined as physically inactive, according to that definition of physically inactive. What's important about this is somebody can be very physically active. They can achieve all of those guidelines in terms of getting exercise perhaps every day of the week, but they can still be highly sedentary. And that's important because a lot of our day, we have a lot of hours in the day. And even if we're achieving those exercise guidelines of 30 minutes, 5 days a week, there's all those other hours in the day that we could be sitting. And so they're both very important to consider. So why is sedentary behavior important? It's gained some recent attention. And part of that is we're very sedentary on average. So on average, Americans spend about 9 hours a day sitting. If you think about our waking hours then, that's over half of the time that we're awake during the day, we typically spend sitting. So that really adds up. It's also important to consider that adults with type 2 diabetes tend to be even more sedentary than sort of the general US population. And so that's why one of the reasons that my work is in diabetes is that sedentary behavior is important in this population. I like seeing folks stand up when I'm talking. It's great, Jennifer. Sedentary behavior also has some unique health effects. So we've talked about all we know about the negative health effects of not getting enough exercise, not getting enough physical activity. But what we found from research so far is that sedentary behavior itself has negative health effects, even among those folks who achieve those physical activity guidelines. So even if you meet those exercise recommendations, there's still, if you sit a lot, there's still an increased risk of type 2 diabetes, a cardiovascular disease, and of death. And so we're learning that sedentary behavior is an important health risk factor, just like lack of physical activity is. So this figure I want to share with you now is one of my favorites, actually. And it's in terms of describing how sedentary behavior and physical activity are both very important. It comes from data from a very large meta-analysis, a very large study of over 1 million people. And it was actually included, this image is included in the physical activity guidelines, the 2018 guidelines. So on the horizontal axis, you'll see moderate to vigorous physical activity. So you'll see that exercise. And on the vertical axis is daily sitting time. And the color represents the risk of death. So very red represents a high risk of death, and green is a low risk of death. And so it's nice because it puts these two things on a continuum where you can see that if you're very, very sedentary, you sit for a long period of time on average over the course of, and again, this is decades of sort of accumulation of risk, that there's, it takes a lot of physical activity to offset the risk imposed by sedentary behavior. Versus if someone is very active, or someone sits very little, it takes less physical activity. And so these two activities are related, but they're not interchangeable. And so showing us that it really matters what we do during our other waking hours. So this is an example of just some of the public health messages you may have seen related to sedentary behavior. And I like to include this just because it gives a sense of what's out there in kind of popular media. There's been some talk about including standing desks, both in sort of typical workplaces and for students. Activity monitors now tend to have alerts that'll tell us if we've been sitting for an hour or so and buzz and remind us to get up and walk around for a minute. And there's also some imaging related to sitting is the new smoking. And then, you know, this couch potato over here and this idea that sedentary behavior is important to consider. So given that sedentary behavior is a newer concept, and given some of the messages I just shared with you, you might wonder, what does the general public really know about sedentary behavior or its health effects, or how we can change it? And there has been some research on this topic, but what we've found so far is that really people don't know very much about sedentary behavior itself and its unique health effects, how it's different from not getting enough physical activity or exercise. They found that some things are motivators to change that would encourage people to change their sedentary behavior. One of the common ones is new awareness, is understanding, it's education, learning about what it is, and then how we can change that. And then also important are ease of incorporating it into current lifestyle. So anything that's easy is I'm more likely to do it if it's easy. And then having little reminders like those activity monitors to sort of prompt us to get up and move around a little bit. There are some key barriers though. Sometimes health conditions can limit people's ability to get up and move around. Back conditions or other things can limit ability to stand in one place. But an important one that I like to touch on is the enjoyment of sedentary activities. A lot of the things we do while we're sitting, we enjoy. Socialization with family and friends, watching a movie, playing a game. So much of what we do when we're sitting are enjoyable activities. And so we have to think about creative ways to change our activity, change our sedentary behavior while we're engaged in that activity, rather than removing that activity entirely. And I think this is could be particularly important for older adults as well, is that a lot of the things that we do while we're sitting, we enjoy. And so when we think about ways to change it, we need to take that into consideration. The other key issue is, again, this reducing sedentary behavior from increasing this moderate to vigorous physical activity. They're both aspects of our behavior that need to be targeted and in different ways. It takes different strategies to modify both of those. So, given what we know, what don't we know about sedentary behavior at this stage? We don't know how sedentary behavior is related to the risk of heart and metabolic diseases like diabetes in older women living in the community. The vast majority of research to date has focused on young, healthy adults. Often these are college-aged male athletes are frequently included in this type of work, and there's reasons for that. But it's important to figure out what role sedentary behavior has in individuals just living in the community with these different chronic conditions. We also don't know how attitudes and knowledge of sedentary behavior might have shifted, given some of the increasing media coverage and the inclusion of sedentary behavior in the 2018 guidelines. Sedentary behavior is new. It was not included in the 2008 physical activity guidelines because there wasn't research to support inclusion at that point. Research has really expanded in the last decade. And so that's understanding how people's perspectives has changed is important. We don't know how mood or a sense of meaning or purpose in life could influence sedentary behavior. And what I mean by that is there's been some research looking at physical activity, and if we're aware of why our life has meaning in terms of some people exercise for their grandchildren or exercise to stay healthy, to see grandchildren, or to engage in activities they enjoy. If we're more aware of that, we're more active. At least that's what the evidence has shown for physical activity. We don't know anything about how sedentary behavior relates to those things. The other thing that might be important there is, given this time of COVID that we're all living in, I think this aspect of mood and mental health and how that relates to our behavior is also a key thing to consider, because obviously this has changed all of our lives pretty significantly. And then also, we don't know how we can support older adults in reducing their sedentary behavior. As I mentioned, a lot of those activities that are sedentary are things we enjoy. And so understanding how we can change that behavior with the ultimate goal of improving cardiovascular health is something that still needs more research. So that brings me to the study that I'm doing as part of my postdoctoral research, and one that is partly funded by the center, which I'm really grateful for. The study we call the SitWise study. And the purpose is to really understand how sedentary behavior is related to cardiovascular health in older women with and without type 2 diabetes. As part of this, what we are doing is assessing knowledge and attitudes towards sedentary behavior, what people know about sedentary behavior and how they feel about efforts we might employ to change that behavior. We're going to be measuring sedentary behavior, and I'll tell you a little bit about that to try to understand how sedentary people actually are. Understand the relationship between sedentary behavior, mood, and meaning, to try to see how actually this time of sort of stay at home in the COVID pandemic, as well as more typical life, how mood and sedentary behavior are related. And then also try to look at how sedentary behavior, cardiovascular health, and insulin sensitivity are related. And that insulin sensitivity, I'll talk a little bit more about that, but that's how well our body uses insulin, how well our body uses sugar. And what we expect to see is that sedentary behavior has some negative effects on the cardiovascular risk in these older women with type 2 diabetes. And it's going to be more significant in this group with type 2 diabetes compared to older women without diabetes. And we think that this is going to be independent of the amount of exercise or moderate to vigorous physical activity that people get. So it's even, taking into account that exercise, more sedentary behavior is going to be related to more cardiovascular risk. So what are we doing? One of the things that we're doing as part of the study is we're doing in-depth interviews. We're actually sitting down with these women and asking them some questions and trying to elicit really rich responses. Not just yes, no, kind of checking a box, but really trying to understand perspectives. So we want to know what does sedentary behavior mean to them? How do they feel when they sit for long periods of time? And then understand both benefits and sort of negative effects. What do people notice about the time they spend sitting and how that affects them mentally, physically, emotionally? We also want to know what people have heard about sedentary behavior. If they have heard anything from in popular media from their healthcare provider about sedentary behavior. And then talk a little bit about what would help people spend less time sitting, with the goal of then, getting people's input on what strategies they think would be useful, and then testing those strategies down the road. So we'll be doing these really detailed interviews. What we'll also be doing is trying to get a sense of, as I mentioned, that mood and sense of meaning relationship between sedentary behavior. And so we'll actually be sending text message surveys multiple times a day to women over the course of about a week to try to understand their experiences in real time. Rather than ask somebody to sort of think back, we can ask them right in that moment how they're feeling, which will give us a much better idea of sort of where things stand. And so we'll be asking about mood and meaning, and you can kind of see some of the questions there that will be included in that. Importantly, we're also going to be measuring sedentary behavior, and we're going to be doing it in a very objective way. It's important because, as a general rule, we're pretty bad at estimating our sedentary behavior. The reason for that is sedentary behavior is the default. When in doubt, sitting is sort of the option. That's what we do. And it's so ubiquitous that we're generally speaking pretty bad at estimating the exact amount of time. And so we're using the two sort of gold standard methods to measure both physical activity, which is an activity monitor that's going to go around somebody's waist, and you can see a picture here, as well as a monitor that is the gold standard to measure sedentary behavior. And this monitor is pretty unique. It's stuck on the front of the thigh with a piece of kind of medical adhesive tape. And it's really unique because, unlike these other monitors that will just look at motion, this monitor, because it's on the front of your thigh, if you think about it, it can tell when you're sitting versus standing. That thigh, the direction of your orientation of your thigh moves. And so it's a much more accurate measure of sitting versus standing, for example, which these other monitors don't do a very good job of. So we're going to be measuring this objectively to let us really look at these relationships without having to rely on our own recall of the amount of time we spend sitting. We're also going to be looking at cardiovascular risk and metabolic risk. And so we'll be asking participants to do an exercise test on a bike and measure the amount of oxygen that their body uses with exercise. And this cardiorespiratory fitness is a wonderful measure of fitness, but it also has a really strong relationship to mortality, to death. And so it's a good indication of somebody's fitness and sort of their status. And so we'll be doing this measure. We'll also be looking at how well the muscles of the body use oxygen. Looking at vascular function in the skeletal muscle. So we'll place a little sensor on the back of the calf and ask them to do some single leg exercise, pushing a weight, and measure how that muscle uses oxygen. And then we'll also be doing what's called an insulin clamp, which looks at insulin sensitivity. So we put in an IV and we infuse both, we give them both insulin and glucose over a period of time. And we adjust those, that glucose over that period of time to keep somebody at a nice stable blood glucose. And that gives us a really good idea of how efficient their body is at using that sugar. So the study is ongoing. As Dr. Regensteiner mentioned, a lot of our work has been impacted by the pandemic significantly. And then that's important. We need to keep our participants safe, and that is absolutely the greatest priority. So we've been really creative to kind of keep going in the midst of this time. We've added an at-home piece where we send people, we actually mail them these activity monitors, and we do a lot of our interview over Zoom to help us continue to collect data, especially during this really unique time in history where people are restricted to home a lot more than they probably were, at least in recent history. And so it's going to be really interesting to understand this time in history and this time in sedentary behavior and mood in the midst of the pandemic. So we are moving forward, and hopefully we'll be able to resume our in-person research activities for this study soon, and finish up some of the data collection this fall. In terms of where this takes us next, the goal of all of this is to gather some really important initial data that's going to support moving the science forward and also my career in terms of where I go next. We want to see, once we get this data, we want to go take the next step of seeing how we can break up sedentary behavior, interrupt sedentary behavior, and see what effect that has on health of these women, women and men with diabetes. And so that's why we want to ask these questions about what people think would be useful interventions for them to break up this sedentary behavior. Ultimately, the goal of all of this is to increase knowledge of sedentary behavior, to increase awareness and understanding that sedentary behavior and physical activity are unique and are both important health aspects to take into account. So to answer the question I sort of posed to you initially, is sitting really the new smoking? The answer is not exactly, and I'll tell you the reason for that. From what we know so far, from all of these large population studies that have sort of looked back, sitting is not as harmful as smoking. We know that smoking is bad for our health. Sitting is not as harmful as smoking, but it is harmful. Sitting too much is harmful. It's been linked to all sorts of negative health effects. And we know that some interventions to reduce sitting have shown some positive health effects in some small limited groups of people. And so my hope is to add to this literature over the course of my career, along with others, and to try to be able to include, better include sedentary behavior as something that we think about in terms of a healthy lifestyle, in addition to physical activity and exercise. So it's not all gloom and doom. The question might be, what can I do? So what I would recommend, based on the guidelines we have and what we know so far, is to strive to meet or exceed those physical activity guidelines. So as a reminder, that's 150 minutes of moderate or 75 minutes of vigorous exercise every week, and to not forget about those muscle strengthening activities as well. So we're supposed to get 2 days a week of muscle strengthening and weight training type exercise. Also, based on what we know so far, just remember to sit less and move more. Challenge yourself to spend a little bit less of your day sitting. And you can be really creative with that. So I have a few ideas here. Think about setting an alarm to remind you to stand up from your desk and take a break, do a lap around your home or outside if the weather's nice. Think about walking while talking on the phone. If you have a phone meeting and you don't need to be in front of your computer, perhaps you can put some headphones in and go for a walk when you're doing that. Think about being less efficient. Now that sounds counterintuitive, but what I mean is, if you have something near the hall you need to pick up, maybe take 2 trips. Maybe you're as a little less efficient in what you carry back to your desk or whatever. These little bits of physical activity throughout the course of the day, this light physical activity, is important. That's what helps offset all the time we spend sitting. And you could also think about doing squats or pacing while cooking, those kinds of things. And there are lots and lots of activity monitors, apps, and other things that try to do this. Lots of apps that target sedentary behavior with little calendar reminders and that kind of thing. And ultimately, the good news is that all movement counts. It doesn't have to be in bouts of a certain length of time. The research is showing us that's less important than we once thought. All movement counts. So I want to end by just saying a couple of important thank yous. I've listed some of the funding sources that I've been very grateful to receive from the Center for Women's Health Research, as well as funding from the GIM Small Grants Program, our CCTSI, and then I'm here in Colorado because of a T32, a training grant through the Division of Geriatrics, and so I'm very thankful for that. Thankful to Dr. Regensteiner, my primary mentor, and my list of other mentors here who have all been incredibly supportive, especially in a challenging year. And most, if not all, most of them, I believe, are center scientists or center leadership or associated with the center in some way. And so really thankful to have that group, as well as our 2 professional research assistants in our lab that have just been invaluable in getting this work started and in being creative to keep it moving despite the circumstances of the last year. So thank you so much for your time, and happy to take questions or interested in your thoughts on this.
Thank you, Mary. That was great. Couple points just to add, since I'm close to the work, the measures that you're making, looking at oxygen consumption and the insulin clamp, which sounds horrible. It sounds like somebody puts a clamp on you, but it's not. It's a chemical clamp with insulin and glucose. And these are gold standard measures, gold standard physiologic measures. So we're using top of the line measurements. I received a question, are there iPhone apps, Mary, that can be used to help you with the sedentary behavior quandary?
There are not a lot of them. There are lots of them that talk about taking breaks. And so they're not necessarily designed based on evidence to target sedentary behavior in ways that we know are effective. They're much more basic than that, but some of them will incorporate calendar reminders. There's some that are simple as timers that'll just buzz and remind you every 60 minutes, or you can change that. There's some that are game-based. Standland is one it's game-based. If you guys, if you remember hearing about the age of Pokemon Go a couple of years ago, and how that was all the rage about going out and sort of this immersive reality and getting people to walk. And so Standland is also a game. So there are quite a few that try to address that. I don't know that there are any that have, none of them that I know of are based on strong evidence in terms of that specific app is helpful for changing behavior. We just don't know that yet. Those apps are really, there's a lot of research going on right now that includes those kinds of strategies, but they're not really out in the prime time yet.
Now, I'm concerned. I walk or run 6 to 8 miles a day. I get up early and I go, and I am still incredibly sedentary because I'm sitting on Zoom a lot. So sometimes I try to do a phone meeting so I can take a walk while I talk. Sometimes I can, sometimes I can't. I'm looking for creative ways to be more, to not be so sedentary. So like at the end of each hour, you can get up and walk for 2 minutes, things like that. It doesn't have to be, a marathon. It can be small increments, but convincing data. I've read a lot of the data, and it's a little bit scary and a little bit annoying as well, but there you have it. Biology can be annoying. So just remember that.
I have a question, and that is the exercise guidelines, the moderate exercise guidelines, and even the nutrition pyramid and all those things that we are so used to using as our guides. Are those based on men or women or both?
As somebody who was on the original panel, they are based on both, but women were not included in many studies, prior to 20 years ago. So a lot of studies, the evidence does come from men. However, the Nurses' Health Study and some other studies did include women. So women are represented at a lower level, I would say. And now that wouldn't be acceptable to do a study like that without women.
I have a question, Dr. Weber. I was thinking you were saying how, you might want to offset by standing up. Is there anybody that measures, or any way that you can measure kind of equilibrium, like a composite score that would say, I sat for 4 hours, but I stood for this and I worked out for this, and that you can kind of, that's my math and numbers person in me kind of saying, how could we combine all of this to say you've at least achieved equilibrium, or you need to keep, is there anything that combines it all?
And that's what we don't know yet. That's really where the gap is. So in addition to sedentary behavior, one of the really growing areas of research is light physical activity and trying to understand what all of that means. The standing, the light activity in the home, the moving around throughout the course of the day. And what it seems like, based on what we know so far, is that light activity is actually what's pretty important. Because moderate and vigorous physical activity, even if people are very active, is a pretty small percentage of our day. And so the rest of those hours matter. And so there are the Canadian guidelines, I think those were just released pretty recently. Those look at 24-hour movement guidelines and trying to encourage people to sort of think about sleep, light physical activity, sedentary behavior, and exercise throughout the course of their day. I would say we're not there yet on terms of what cancels out one another. We don't know really anything about that dose response sort of piece other than that sort of gradation figure that I showed you, but we don't have numbers. We really don't have numbers to say, what do I need to achieve? If I'm going to sit 6 hours a day, how much light activity, how much moderate to vigorous physical activity do I need to achieve to sort of negate my risk? That's still needs to be done.
Opportunity for the center, Jennifer. We can develop the app.
Right. That's what I was thinking.
Ed Harvey,
Yeah, I've got two questions about your research method. One of them is doing this work during the pandemic seems like that you'd automatically get a bias in there that really wouldn't be applicable in the non-pandemic period. That's number one. And number two, and then kind of thinking of relatives and people that I know, there's a lot of guilt associated with sitting too much. Younger relatives would, and I can think of my aunt where I bugged her all the time about, you got to get walking, you got to get moving. So a lot of people go into this thing with a fair amount of guilt, and they build up excuses associated with that. How do you overcome those sort of biases in your research method?
Those are both really good points. To the first one, absolutely. This is we've heard constantly, but it is unprecedented time in terms of complicating the research that we're doing. This study was actually approved to begin early March, the week before we shut down the university. And so it was designed not in COVID times.
Right.
And we know that COVID has absolutely changed that. That's the reason that we're measuring this physical activity and sedentary behavior, is at least we're able to quantify where that activity is in relationship to these risk factors. Knowing that, I think every publication that's coming from this sort of phase is going to have this caveat that it was conducted during COVID, and so there's this unique situation that we can't generalize it to what we would expect otherwise. I think the things that we're going to learn about relationships between mood and sedentary behavior are still valuable. Knowing that those relationships might be different if we're not quarantining, if we're not facing the same, mental health and other issues that COVID has imposed. And sort of, the goal right now is we're hoping to gather data and take a look at this data in the context that it's coming from. We recognize it's COVID, and so it's going to be interesting to see these relationships and know that more than likely what will need to happen down the road is something similar. We collect some similar data in not these times to try to understand if these relationships are the same.
Right.
I don't know. It certainly presents a bias that we don't know exactly to what degree yet. So absolutely. The issue of bias in terms of that guilt or sort of hearing from others that we should sit less, I think it's a very real thing. And I think that's why trying to understand, if people have gotten some of that negative feedback or those negative opinions from family members or friends, eliciting that in the interviews is going to be really interesting to understand. And that's why I think, just like physical activity, if we're not active, it can come with it could potentially come with some sort of sense of shame, like I'm not doing this for my health and I should be, or something like that. Absolutely. I think the same thing can be present in sedentary behavior. And so that's why I think, to me, sedentary behavior presents a unique opportunity. Physical activity is absolutely important. We know that based on the evidence. But not everybody's physically active. Very, a small, not a large percentage of the US population actually achieves those guidelines. And the amount of people achieving those guidelines goes down as we get older. And so I think targeting sedentary behavior in some way could be a stepping stone to helping people become more active in really practical, easy ways. Standing up a couple times, a couple more times a day, taking a lap around the couch when you're watching TV in the evening and the ad comes on or something like that. I think that because we know that all movement counts, it doesn't have to be this all or nothing sort of thing. I didn't get 30 minutes today, it's a whole wash. Trying to educate people and talk about those issues and recognize that those are important things is really important. Yeah, I think you raise a great point, as it certainly has the potential for sort of creating a sort of blame shaming sort of relationship where you're saying you're not doing what you should be doing, and that's, so absolutely we need to think about that in these types of interventions.
No, I don't find guilt to be a very effective weapon against inactivity. Most Americans, about 85%, don't even take a walk once a week. So guilt hasn't worked very well. I don't think anyone would say, hey, I didn't know that physical activity was good for you. But still, this group is probably biased towards more activity, just highly educated group of people. But I don't find guilt to be an effective motivator. I know because I tried it with my mother, rest in peace, my mother, for many years, and it did not help. So I think we have to find other ways to motivate people. Connie.
Yeah, this may be more complex than we want to talk about here, but I'm wondering what physiologically happens in the body when one is standing versus when one is sitting. Is it blood flow? Is it oxygen utilization? Is it calorie burning? Is it all of the above? I mean, why is it so fundamentally important?
That's an area of a lot of focus right now, is some of those physiologic mechanisms as to why sedentary behavior might be unique or seems to be unique based on this population level data from physical activity. Some of the things that we're learning so far is that in terms of vascular health and blood flow, for example, if you're sitting, that reduces the amount of shear stress or sort of velocity, sort of the blood flow in the legs, in the big arteries in the legs. So it's not kind of same force that's happening. And if that happens for long periods of time, they're hypothesizing that could be one of the reasons that vascular health is poorer if you sit more. But there's a lot of work going on in that area that it's unclear. The other thing is that it's thought that there's been a fair amount of work in looking at blood glucose control in diabetes and breaking up sedentary behavior. And they found that in very controlled conditions, in short-term lab studies, if they have people sit for, let's say, 5 hours, just not doing anything during that time, versus during that 5 hours, getting up and doing a light walk every half hour, they found that the people in that second condition have better blood glucose control. Mm-hmm. And that's thought to be, you burn more energy. There's studies right now, there's a call to do more studies that really look at that total energy expenditure and why that matters. So for example, sitting for 5 hours and breaking it up every half hour with a light walk, versus if I do 20 minutes of moderate exercise right at the beginning of the day. And how are those three things different, and why? Is an area that's really growing, and it's an interest of mine too in terms of the vascular health.
And is blood flow different in someone with diabetes versus someone who does not have diabetes?
Yes, we think so. We're actually studying the effects. Jane Roosh and I, in our funded research, NIH, are studying why blood flow it's not that the blood isn't there, but it gets directed inappropriately, probably to the right tissues. And the heart doesn't function the same either. Mm-hmm. We are looking at those very good questions, Connie. We are looking at those exact things in our research, because we think that's why people with diabetes don't exercise as well, which is important, because exercise, as Mary noted, is linked to mortality.
Yeah.
It's an ongoing piece of very interesting physiology.
Yeah, thank you.
Sure. They have, the fact that exercise, physical activity, sedentary behavior are linked to mortality is really, it's a public health issue. in the United States, it's really a public health issue because all people tend to be sedentary in this country, particularly. And it's since it's associated with heart disease and diabetes and death, we have to figure out ways. And as Ed aptly pointed out, guilt is not a rewarding technique. And so getting people to be more active is hard.
Mhm.
So ideas are always welcome. Lida.
Yeah, I'm interested in hearing more about this thigh patch that measures sitting and standing.
Mhm.
How smart is it? Can it, does it have like a Bluetooth connection to something maybe like a smartphone? And the reason I'm asking this is once I get working at the computer, I get so wrapped up in it that I don't even notice my smartwatch telling me that, I should stand up or move around. So I think I need to find out more about my patterns.
Mhm.
Can you just tell me about how this patch thing works?
Yeah, it's so what it is it includes an accelerometer. So our phones all have accelerometers that measure motion. If you've ever looked at like the health app on an iPhone, it'll try to estimate your steps based on that motion. So this monitor, it's a research monitor is the downside. So it's not something that we can get immediate feedback from, and it's not something that links to cell phones at this point. It's called an active pal, but it's a very thin little monitor that sticks on the front of the thigh. And because it has that accelerometer in it and has sort of axes in 3 directions, it can tell when it's flat versus standing up like this. And so it can, because of that orientation, it knows whether I'm sitting or standing. And so that is the gold standard way to measure sedentary behavior right now in research. We don't have good ways really of measuring sedentary behavior just in the community for the usual consumer. We don't, our smartwatches try to estimate that, but you might notice that sometimes you get your steps just by typing pretty vigorously on the computer. They're easy to fool. So these watches, all of these consumer devices are, what they're doing is they're measuring kind of acceleration in different directions and then using some complicated algorithm to try to say what you're doing based on what it's measuring. There's varying degrees of accuracy. For most cases, they're probably accurate enough to let us sort of just know how our activity is changing, but they're not exact. And so I do not know of a sedentary behavior monitor that's consumer just available at this stage. But maybe thinking about setting some timers that actually are audio alerts or something like that on your phone could be a way of reminding yourself to stand up when that buzzing on your watch isn't enough to interrupt what you're doing.
And it shows you how new the field of sedentary behavior measurement is. So there's another thing we can invent, Jennifer, from the center, another creation that's needed. It's exactly what we need, is something that helps us with sedentary behavior. And there's nothing practical for the consumer right now.
Mm-hmm.
Well, I know that we are running low on time. It's been a great discussion. Thank you so much, Dr. Mary Whipple. That was really great. Very, very clear and excellent